Hey everybody, my name is Marie Ridgeway. I'm a master's level clinical social worker in Minnesota and a trauma treatment specialist. At my practice here, we specialize in working with first responders and law enforcement. And I'm excited to be talking today with Christy Hatcher. She is the expert on ketamine treatment, ketamine infusions. Specifically at our practice, we refer clients to ketamine infusions for PTSD. So we'll be hearing about that as well today. But I'm looking forward to getting you to know a little bit more about why ketamine, how it works, and then also what to expect if you are considering using ketamine treatment or someone that you love is. So I will turn it over to Christy.
Okay, thanks, Marie. And thank you just being who you are and what you do. It's much appreciated. And I think it's a wonderful thing that we're able to collaborate to help people together because two pieces are so important to be able to do those things, which is ketamine itself and the actual therapy piece of it. We titled the presentation today called Lifting the Veil, because ketamine is one of those medications that people do talk about. They feel that what it does is it opens up a whole new world to them. It lifts the veil onto the things that they thought, helps them to reorganize thought processes and change how they feel. So a little bit about myself. I actually am a registered nurse and anesthetist. I've had my master's degree in anesthesia for 20 years, worked at a level 1 trauma hospital where I took care of multiple kinds of patients, seen many, many different kinds of things, including lots of traumas, which is, kind of had an impact on my life as well. I've used ketamine in that 20 years in the operating setting, and then moving forward now, I use it at my clinic. I did retire from that profession or that position back in July, so that I am now just doing ketamine infusions at my clinic 100%, which is something that I love very much. So I just kind of want to tell you a little bit about my personal connection with ketamine, because I believe that that's also very, very important. I have a son who started doing ketamine infusions 5 years ago at a different clinic. He suffered from anxiety, depression, post-traumatic stress disorder, and suicidal ideation. He's tried every medication in the book, tried therapy, done everything he could, and nothing really seemed to help. And he still was at the bottom of the barrel, like he was not sure if he could go on with life, actually. So he began infusions at a different clinic. At the end of his first infusion, I said, "How did it go?" And he said to me, I'll never forget, he said, "I don't know how I know, but I know everything's going to be okay." And it was that moment that I knew that this is something that I wanted to be a part of. I wanted to be able to help people. I wanted to be able to share with other people that there are other things that are options and that there is hope. So it was after his infusion that I talked to a person that I knew who also had interest in ketamine, and we together opened a clinic. We opened it 8 months after my son began his infusions. And my son was the first person that we actually did an infusion on at our clinic. So it has a special thing for me. I guess the thing about it too that's difficult is that my husband, I did lose him after we opened the clinic 4 months after it to suicide. So I also have I have a personal connection with the suicidal ideation piece and the suicide piece of it. So it's not that I'm also a provider, but it's also that I am a family member, I am a parent of a patient, and I am also a suicide survivor. So I know how it feels for those people that are sitting in that chair that have those suicidal thoughts. I don't know how it feels, but I know how it feels to be on the other side of it. So I have a passion for this, and I guess that's one of the main reasons I'm here. Okay, so when you come into the clinic, this is just kind of some pictures of what you'll see. You come in and we try to make it as warm and as inviting as possible. This is the lobby of the space. And then this would be a picture of the infusion room. So if you kind of can't imagine what it would be like to do an infusion, this is kind of the setting that you would come to. All of our rooms here are private. We do patient monitoring, which just means we monitor your heart rate, your blood pressure, your oxygen levels, just to make sure that you're safe throughout the entire procedure. Being an anesthesia provider and being ACLS certified, you're in a completely safe medical environment, so nothing to worry about there. But on the medical side, we also don't want it to be seen too medical, so we're very careful in how we do that. This is a picture of a patient who's actually doing an infusion. It's a comfortable space. It's a quiet space. We try to make it as calm and quiet as possible, just because that does tend to lead to a better infusion process. So what is ketamine? When you talk about ketamine, people think of it as different kinds of things. They've heard of it called a horse tranquilizer. It is a street drug. It is multiple different things that people, when they hear the word, think of. But truly what ketamine is it's a dissociative anesthesia medication. It was first synthesized in 1962, and then it was approved for anesthetic use in 1970. One of the big things that ketamine was used for, it was used in the Vietnam War when the soldiers were out and they were injured in the field, and it would be very difficult to move them because they had such severe injuries. So they would take ketamine, do an intramuscular injection, and then it dissociates the mind from the body, being the dissociative anesthesia that it is. And then those patients were able, or those soldiers were then able to be put onto the gurneys and then transported out of the field and onto the helicopters and into the hospitals without them feeling the pain of it. So it was used really widely in that time frame. The thing about ketamine and what we're doing here, it is not FDA approved for the use of mood disorders. It is considered a use as off-label medication for it, but in the standard world of medications, there are many things that are used in an off-label practice. So it's not unusual, it's just something that the FDA hasn't exactly said, here's your go.
Christy, is there some insurance coverage now for ketamine treatment for the use of mood disorders, for the treatment of mood disorders?
That's a tough question. There are some companies that are starting to recognize it a little bit. Lots of them still look at it and say that it's experimental or it's investigational, so they're not necessarily is ketamine itself covered. Some clinics are getting some reimbursement for like the office visits and the procedure, that kind of thing. So we are seeing some coverage come through, yes. Some of the insurance companies are a little bit more stringent than others, but I do feel that it is a push. And with everything that's occurring in the world now, I think that in the future, it will be to the point where they will recognize it as a treatment and that they actually will start to cover it. So
neat. Yeah, it seems like with all the good evidence and studies that it's got to be well on its way.
Exactly. Yeah, exactly. So how does ketamine work? Ketamine works two different ways. The first part that we're going to talk about is the dissociative piece of it. So being a dissociative anesthesia medication, what ketamine does is it causes this dissociative journey that happens during the infusion process. There will be vivid dreaming is a way to look at it, where you're still awake, you're still going to have these thoughts and these processes that are more in a dreamlike state. You may feel like you're floating, you may see shapes, you may see colors, but what you do is you're leaving the space that you're in, which is this narrow-minded place that we live in this world that we're in every day, and it allows you to leave that space, journey to an elevated thought process or an elevated way of seeing things and perceiving things. And what it can do is it unlocks subconscious thoughts and perceptions that we have of life events or things that have happened in our lives. And when you're in this elevated level, you then now can see those things from a whole different perspective. It's like climbing up and looking back down upon things, but in a different perspective. You actually become more aware of things around you and people around you, and just the fact that it's not a small individual little narrow path, but there are many, many options that go within that path. So what ketamine does is, in that process, when you're on that dissociative journey, it can allow you to pull open things that you've locked and blocked away and re-look at them and see them in a different perspective. So it reorganizes your thought process and your perceptions and allows you to put it in a better package and put it back in a better place. So then when it comes up, it's not as difficult. It's always going to be there. It's never going to go away, but the perception and how you feel with it and how you see it and how you deal with it can change, and that can be a healing piece. We kind of call that lifting the veil. The second way ketamine works is called neuroplasticity. What it does, or what it's thought to do, is it changes the neuroplasticity of the brain, or it's a regeneration of the neurons of the brain. Over time, with the stress response, we do see that the neurons of the brain start to break down and they stop connecting. It's like the roads are broken, and so it's really hard to make decisions. It's hard to find ways to cope. It's just you no longer can put the pieces together because there is no connection. So with ketamine, with each infusion, what it does is it increases the neuroplasticity of the brain. It causes this glutamate surge, and this glutamate surge then causes the neurons to start to regrow. There is some scientific research on that. We have something listed here, which is just a recommended resource, which indicates this picture, which is a before ketamine neuron, and then it is the nerve growth after ketamine. So you can see that the neurons do start to regenerate, start to regrow, start to reconnect. And it's in that reconnection that helps to coping mechanisms, how you feel, your mood, all those kinds of things just start to get better with those reconnections. So I would say with ketamine infusions, it's extremely promising. It's not guaranteed that it's going to work for everyone, but what we do see, at least at our clinic, is we're seeing probably 70 to 85% effective rates for people that do ketamine infusions compared to standard antidepressant or mainstream medications, which are listed at probably 30 to 40% efficacy. So the likelihood for someone that comes through the door that's tried every medication that there is, will have a result with ketamine. It's 70 to 85% effective, meaning they are very likely to have a positive result with it. So we do see that it is extremely promising, and it's a wonderful thing for people to try that have tried a lot of things and have had no results. So indications for use with ketamine. At our clinic, we do use it for mood disorders, basically, which is clinical depression or treatment-resistant depression. Treatment-resistant depression means that it's people that have tried at least 2 or more standard antidepressant medications that have failed in the past, or they just don't seem to help them or don't help them very well. We also treat anxiety disorders with ketamine. Post-traumatic stress is a huge thing that we do with ketamine, and then suicidal ideation. On the post-traumatic stress piece of it, I think the thing about it is it's because with those stressors and those events that have occurred, the mind has and I'm not a therapist, so I'm not, just in my perception, it's like those events that have occurred, you have a perceived response to it, and it's how you see it and how you view it. What ketamine wants to do with those post-traumatic stress events is it actually wants to open up that thought process, pull those things forward, allow you to see it from a different perspective, and then heal from the pieces. So it's used as a tool to do that. On the suicidal ideation thing, ketamine is one of the few medications that actually can quiet suicidal thoughts. And I know that post-traumatic stress and suicidal ideation, those two things go together quite a bit. It can actually suicidal thoughts for a lot of people seem to be just dark, intrusive thoughts that are constantly there, constantly nagging, and they don't control them. Because if they could control them, they definitely would. They wouldn't have those thoughts. Ketamine has been seen to just decrease or quiet the thought process, and you don't have those nagging, constant thoughts that say you're no good, you're not okay, you'd be better off if you weren't here, your family'd be better off. So it's pretty amazing. And in my mind, I kind of feel like suicidal ideation should have its own class, but
yeah, awesome. I was just going to add, it's really interesting the way that it seems to me ketamine seems to heal in a very similar way to eye movement therapy like we use at our office. So like EMDR or accelerated resolution therapy is what we use. It ultimately, what we look for is someone to be able to see what they experienced as traumatic from the third person, almost like you're witnessing it and you're not in it anymore. And it seems like ketamine actually brings you to that same sort of headspace with trauma, but from a chemical approach. So really interesting parallels that I see with it.
Yeah, exactly. And you're exactly right. That's the thing about being able to see things from a different perspective. We in this general world can't do it without the assistance of something. And ketamine is that thing that does assist and allow you to go to that higher level of perspective. So use in a clinical setting, how we use ketamine at our clinic. The recommendation is that everyone that does ketamine does a series of 6 infusions. We do it twice weekly for 3 weeks. And that's the reason we do that is because some people respond for ketamine infusions immediately. We have people that do an infusion and they know that they're going to have positive results, just like my son did. But there are also people that don't have a positive result until they get towards the end of that series of 6 infusions. So if you were to do 1 infusion or 2 infusions, you may not know that you're going to have benefit. So you kind of be missing that window. So that's why we recommend that people do that 6 infusions. And then if you do feel that it's helpful and you've had positive results, Most people do maintenance of some sort to maintain those results. We see maintenance infusions on average of once every 3 weeks to once every 6 weeks. I feel that's more on the mood disorder piece of it. When you're talking about post-traumatic stress specifically, that may be different, just because if you've been able to process and work through things, it may be better, and you may only have those times come up that are triggering, or holidays or events or that kind of thing, where you would need to do like a little bit of the maintenance around those timeframes to maintain what you've gathered or what you've gained, and then kind of move forward from there. During the clinical setting, we do monitor your heart rate, your blood pressure, your oxygen levels, so that you're in a safe environment. Nothing to worry about there. Side effects of ketamine, there's just a few varying side effects which can cause nausea, changes in blood pressure, changes in heart rate. Sometimes people feel a little anxious about it, but once they've done a few infusions, they're pretty good with it. But if there are any of those things that do occur, we do have the capability to treat anything that would happen in the clinical setting. So. A big thing about ketamine infusions is the affordability for patients. And like Marie and I, we talked about the insurance coverage piece of it a little bit already. So it's kind of one of the things too at our clinic, where some insurance companies we're in network with, some we're out of network with. So it's dependent upon the specific company. But cost for it out of pocket, each infusion for the first series of 6 infusions is $500 per infusion. And then maintenance infusions, which would be number 7 and thereafter, that cost goes down to $400 per infusion. That is out of pocket cost. We do offer a discount for all frontline workers, all veterans, anyone that's in that line of work. We do 50% discount on all infusions. So those infusions for those patients are $250 per infusion across the board. So we do have this video that we put up here. We're not going to play it today, but it's really a good video. Yale Medicine did it, and it's them explaining how ketamine works. It's like a 3-minute, 50-second video. It is very, very interesting. And just to know that when you watch it, you're kind of hear the same information across the board at every location, no matter where you are in the United States. People are seeing the same kind of changes with ketamine infusions, with the thought processes and the neuroplasticity, and the, just in general better well-being. So it's a good watch if you have time. And then I guess the thing that I want to say finally on my end is that the thing about ketamine is a tool specifically. It's not a cure, so you can do infusions and you can do them without therapy. Ketamine can be its own therapist at times for people, but we do recommend a collaborative therapeutic approach when all possible, just because when you do it in conjunction, what the therapy part can do is it can actually help to reorganize the thought processes that you've experienced during the infusions. It also helps the patient to explore new visions of what you've experienced, because ketamine will open windows and open doors. And then what do you do with that information once it's occurred? So it's like being able to solidify the things that you've had happen in the infusion and then use it moving forward. So it's kind of a merging of the experience process and then reconnecting the neurons together and then finding a healing and a new approach. So.
Awesome. Well, good. I wanted to say thank you for doing this, and also thank you for when we collaborate. We have mutual patients or clients who have had such remarkable changes and feelings of healing because of a collaborative approach. On our end, it's allowed people to talk about things they had been locked up about and unable to. It's allowed people to feel like, quote, themselves again, and for loved ones to feel like they have their loved one back who had previously been stuck in the way that PTSD kind of locks up the brain and the functioning and the feeling. And so I'm really glad that we were able to talk through this and get some explanations from you. You're much better at explaining it all than, of course, I am when I try. So I'm really appreciative. I appreciate it, Christy.
Yeah, thank you so much. And for me, I think the thing is, in my world, my goal is to get the word out to people that ketamine is something that actually just exists. I think that a lot of people don't know about ketamine, or what they do know is they see it, used in a way that's not helpful, and it's like so beneficial that we just need to get the word out that there is an alternative treatment that exists out there. If you've struggled and you can't find something that really does help, give it a try. It's the one thing that just may be able to help you where something else didn't. And I think also in the frontline worker field, police officers specifically, there is this thought of the way ketamine was used in restraining, I don't even know what the word would be, but in using
sedating.
Sedating, restraining people. And that's a completely different usage of ketamine. So when you think about it, you have to put those pieces in different boxes in different places on the table because it's a completely different usage. It's like using ketamine in the operating room. It's used completely different than we use it here. Using it in the field, it's used completely different than we use it here. What we're doing here is specific. It's specific dosing, and it's research driven is the other piece of it. So what we're doing and how we do it at our clinic specifically is about the research that's out there, and we're trying to follow the guidelines that are set forth, and what they've done and what they've learned, and then we kind of take it and we run with it, so.
Yeah, wonderful. Yeah. Awesome. Yes, I love being able to distinguish the way it's being used in this way versus kind of the bad reputation it has gotten over the years for good reasons sometimes. But we don't need to always keep those associations. It's good to have new information and accurate information. So thank you. I really appreciate it.
Thank you so much. Yeah. All right. Thank you.